going just now, so I think we've got a few people all logged in as well, and I've got some working behind the scenes to let people in. So we might have some more people turning up. So for everyone that's tuned in, thanks so much for tuning in today, today's instalment of CANTalks from COVID Action Network. I'm Dayna, I'm a freelance journalist. I'm notoriously vocal about mental health, and you can find my work in publications such as Metro, Cosmopolitan, Stylist and more. This week, COVID Action Network has been hearing from experts, charities and advocates about mental health in the wake of the pandemic. And today I'm joined by hopefully 3 guests to delve into this a little bit further. So with me today, I've got Dr. Victoria Khromova, who is an NHS child and adolescent psychiatry consultant, and she runs her own parent coaching business called Emerging Parent. I've got Dr. Jo Billings with me, who is a clinical psychologist at the UCL Division of Psychiatry. She has particular clinical and research interests in PTSD, trauma, resilience, and the mental health and well-being of high-risk occupational groups. And Tanja Bozic, who will be joining us hopefully in the next couple of minutes, is a UKCP qualified couple and family psychotherapist who works in London, and also appears daily on Happy TV, a mainstream national television programme in Serbia. So I guess the best place to kick off with all of this is to kind of look at the topic in broader terms. So what does the pandemic mean for our mental health? What does it mean just now for people who are in lockdown? What might we be experiencing? Do you want to take that one, Jo, and start off with that?
Yes, I mean, I suppose there's 2 parts to this really. There's the impact of COVID-19 itself on people's mental health, but there's also the impact of the measures we're taking to manage COVID-19 that's going to impact on people's mental health, and they're obviously related, but they're slightly different. So the disease itself is going to be impacting hugely on people who contract it, their families, the people close to them. It's impacting very directly on health and social care staff who are working to treat it round the clock, but also the measures we're taking to manage it, social restrictions, lockdown, quarantine, that's all going to be taking its impact on people's mental health as well. People are not able to connect and reach out to social support or meet with people in the same way that they might have done beforehand. There's huge economic repercussions of the lockdown that's going to have a much longer term effect on people's mental health. I mean, those are just a few of the headlines.
And what about you, Victoria? What do you think people will be experiencing potentially for the first time in lockdown, or how might it be affecting their mental health?
I think I agree with everything Jo has said. I mean, I really love the way she's put them out into kind of different categories. I mean, obviously for me, especially thinking about children, I think what's really tough is kind of they'll have different understandings of what's going on, and at least with adults there'll be kind of some logical understanding what's happening, and older children will be able to do that. But I think for younger children, they're actually learning kind of behaviours that are really odd now, you know, like staying away from people, and that's all quite unusual. And just thinking about that kind of as an extra really to what Jo said, that some of the things our children will be inadvertently learning because, you know, explaining to them sometimes isn't going to really help them understand depending on how young they are. It's just going to affect their mental health in that way as well.
And sort of delving into that a bit further, actually, Victoria, so we've been discussing sort of children's mental health this week over at COVID Action Network. So what, for like parents who might be tuning in just now, what might they be experiencing with their children in lockdown? In terms
I think it's kind of gone through different phases. I think in the earlier phases probably had, because of the sudden changes to everything in their life, you know, huge upheaval to the kids, probably see lots of different things, but I imagine increased anxiety generally, probably kind of more, almost like your kids regressing slightly, so needing you more than they used to, perhaps not feeling as confident or independent as they used to be, and kind of almost like you've kind of slightly gone back in time and you've got a younger child. I imagine that phase is now past, and I think how your child is will probably really depend on how they've managed it and how you've managed it, because I think, you know, kids are really impacted by their parents' mental health and all the things that Jo has said. So, you know, if they're experiencing financial difficulties, if they've been poorly themselves, or if people in the family have been ill with the actual virus, and of course depending on that. And I think for some children who perhaps have been in households that have not been as affected as much, or perhaps their parents have managed it fairly well, they might actually be regaining, you know, that independence back, confidence back, and sort of returning to their normal selves, really, with some extra skills. Whereas I think for children who've been in households where there has been illness, there has been a lot of impact, and perhaps their own parents have been experiencing mental health difficulties, they're probably essentially taking on those mental health difficulties too. So if their parents have been really anxious, they're probably more anxious themselves, and some of the parents have been low.
And sort of talking about that sort of more high risk exposure to mental health, actually, Jo, who, I know that you obviously do work with high risk groups, who will be getting most affected by this in terms of mental health right now?
Yes, it's a good question. I had a lovely analogy the other week. I can't claim for my own, but I thought it really captured it. The idea that we're all weathering the same storm, but we're actually all in quite different boats. And people are having very different experience of this. For some people, it's given them more time to take stock and actually spend more time with their family and not have the stress and worry of commuting and work. But for a lot of people, it has been very, very difficult. And we've identified particularly high-risk groups who are particularly vulnerable and who are particularly likely to see either the development of mental health problems for the first time and the exacerbation of mental health problems. And the particular high-risk groups we've identified are frontline healthcare and social work staff. And that's not just doctors and nurses, it's cleaners, receptionists, porters, people who we often don't think about, but who are kind of seeing things and dealing with things really on a scale and of a duration that they haven't really seen before. Obviously, people who have experienced COVID themselves, a huge proportion of people who've experienced COVID who have had to have quite invasive procedures, go into hospital, perhaps have been through ICU. We know a huge proportion of people, about 20 to 30% of people who have a stay in ICU develop post-traumatic stress disorder afterwards. So they're a really vulnerable group. And then outside of that, we've got people who already have underlying mental health issues, who might be quite negatively impacted, and also some more of the kind of hidden groups of people. Victoria's nodded to this, sort of some children, perhaps particularly vulnerable children who are at home, who haven't got the social support of teachers and friends and school at the moment, victims of domestic violence. So there's kind of hidden groups as well as the obvious ones.
Well, I think we have Tanja with us now as well. Tanja, can you hear me?
Yes, please. Yeah.
Hi, Tanja. Yeah, so we're just discussing who's most vulnerable to experiencing mental health, poor mental health in these times, if you'd like to weigh in on that.
Well, basically, regardless of, if we're talking about children, regardless whether they're primary or secondary school age, they definitely in these times might suffer more of mental illness presentations. It does have twofold effects. Some children might withdraw themselves. They might be spending more time, obviously, playing video games, because obviously they're not going to school literally. So, it might, they might develop some anxiety features. So it all depends on the child's personality in general, but definitely all of this social distancing, even if they go out to parks and, where they used to be playing with friends before, it can have an impact on children, regardless of their age, as I say, whether they're primary school or secondary school. In adults, obviously, it all depends on who we live with. If we're single, if we're a couple, whether we live with someone. So definitely the main emotion addressed here is fear. So there will be any presentations associated with obviously dramatic increase in fear. Many of us have experienced this. So yeah, it's very, very difficult.
And I mean, people are speaking about this tsunami, is what they're saying, the tsunami of mental health service referrals that are expected after lockdown. And is that what we should be expecting? I know some of yourselves are working during this pandemic at the moment. Victoria, what do you think?
I think certainly from the children's services point of view, I think we are not really able to see children in the same way that we used to. Sort of community teams are really not able to get out to them and see them in the same way. So many things are happening over the phone, and I think it's just not the same. So I think what's going to happen is once that returns, there's probably going to be young people who haven't quite had the input that they've needed, and therefore they have got a lot worse. And I imagine at the moment, obviously, children who are coming sort of through GPs and stuff, they're just not going to have the same referral rates because GPs are dealing with, the fallout from all the physical health. And I think, to be honest, this is true for probably all health specialties anyway, that because there's such a huge focus on COVID at the moment, those other things aren't getting sorted, but of course they'll come back later when COVID has settled down.
And what about you, Jo? What do you think?
Yeah, just to reiterate Victoria's point, I think a lot of mental health services have actually seen a decrease in referrals during the peak stage of the crisis. People perhaps very anxious about going out, seeking help, not wanting to burden health services. So we're kind of a bit worried about where all the people who normally need help are, because it's not that they don't need help anymore, but perhaps they've been delayed in their help seeking. So we've got to accommodate those people, and the people whose treatment's been put on hold, because those people still need and deserve treatment. They've been waiting even longer for it. So we've got people who already had or have pre-existing mental health issues, and then we've got people who are going to be affected in terms of their mental health from COVID directly or indirectly as well. And I mean, we know in trauma that actually, when people experience something very distressing, something very out of the ordinary, something very traumatic, it's quite common to be quite distressed and quite disturbed by that in the first few weeks. And that's one of the reasons why we don't diagnose post-traumatic stress disorder until at least 4 weeks after a traumatic event. So we're going to see, I think, more people coming through with PTSD, anxiety, depression in the coming weeks and months. I think there's a bit of a lull now, but that's coming. I'm not sure if it's going to be a tsunami coming at us, but I had another good analogy, which again I can't claim to be my own, from a colleague at UCL, Professor Tony David, who talked about it not being a tsunami, but the water's lapping at our feet further upshore than we might normally be used to.
And I take it this is something that's going to be more apparent as obviously we come out of lockdown, and there's a debate as well that adjusting back to normal life will be traumatic in itself after becoming adjusted to lockdown as well. Is that something that we should be expecting as well?
I think it's very hard for people to make transitions, and humans, we don't like uncertainty, and there's a lot of uncertainty around us. I've had a lot of people saying, if only I knew when it was going to end, even if it was some weeks or months away, I'd be able to manage better. So it's really hard for us to deal with uncertainty at the current time.
Yeah, completely. I can definitely relate to that. Actually, going back to the point of frontline staff, so what support is in place for them? I mean, even for yourselves, out there working just now, because obviously conditions have changed massively. Like if you're working through a pandemic as an NHS frontline nurse, obviously it's very different to your normal night in A&E.
Yeah, I mean, there's been a lot of support mobilised for frontline workers. So by and large, that's a really positive thing. There's been helplines set up. There have been text messages services. There's been a lot of mobilisation of mental health workers to offer sort of more informal, light touch interventions in the first instance. There's been a lot of really, really good work happening. I think what we don't know yet, and what we need to establish very quickly, is what help people need when. Mm-hmm. And what we're hearing from frontline workers is actually in the peak phases, in the crisis, a lot of the support they want is actually more around their kind of basic human physical needs. They want adequate PPE, they want enough sleep and recovery, they want to be able to work reasonable shifts, they want to feel safe when they go home and see their families. And then as we kind of get over the peak of the crisis, people are they're kind of starting to process and assimilate or not what they've been through. And it's during that period of time, I think, that people will either sort of engage in natural recovery from a very difficult traumatic experience, but not develop symptoms of any mental health disorder, or perhaps go on to develop something that could be diagnosable as a mental health condition.
And then obviously, Tanja and Victoria, both yourselves, you're working through the pandemic at the moment. How has that been, and what have you seen an increase in, cases of people coming to you with COVID-related anxiety?
Well, I personally,
you go, Tanja.
Thank you, Victoria. Well, basically, I work my private therapy clinic. We do have free sessions for the key workers, and I can tell you that I currently work with 6 nurses who are frontline care workers, and it's very difficult. Most of our sessions, they're really, really severely stressed. They cry a lot. They suffer anxiety features, depressive features that before COVID they never experienced. So that's a big concern, because people who never ever experienced any sort of mental health issues are now starting to really suffer particular features. And that is what worries me, because it's almost 2 months now, and these people go in and out. They do 12-hour shifts, and basically some people who've been very brave and they're very well trained, they're really showing signs of mental health disturbances. So that's what worries me. When it comes to private sector, we do work online. However, again, psychotherapy is something that you need a human contact. So many clients have refused working whilst Corona because they prefer to go to our office and see us in person. So definitely business as well is not as usual. And to be honest, only yesterday did we get a letter that we might resume working face-to-face, obviously using appropriate measures like face masks and gloves. But many of our clients are just hesitant to go back into treatment. Now, when we talk to mild to moderate-ish presentation, that's okay. But we have many people with moderate to severe mental health conditions, and definitely in these times they're going to be boosted. So yes, there are many worries regarding the issue.
And what about you, Victoria? How have you?
Yeah, I mean, I think obviously I'm not really working in the frontline centres in the sense that I'm not. I have looked at I work in an inpatient unit for adolescents, and we have had COVID on our ward, and we had it very early on. So I think at that time it was almost just getting to grips with things. But I think a lot of the stuff that we get sort of tired by really is actually containing all the families, because obviously I look after teens and their families can't visit in the same way, and there's so many restrictions now placed on them being able to go home, which is really unusual and really unhelpful actually. But that's kind of how we have to work, and a lot of our energy is spent on containing the families around the kids and containing the kids. So it's a kind of different kind of stress to obviously the really acute stress that workers are suffering from actually experiencing patients with COVID. For us, it's just trying to contain the anxiety around us, which actually can leave you feeling really quite tired.
Yeah, of course. And during all of this as well, there's going to be a lot of, I suppose, first-time mental health patients as well. I mean, I know certainly speaking to other people while doing this project this week on COVID Action Network, I've spoken to people who do suffer from depression and anxiety, who kind of know what to expect. Obviously, it's unprecedented times. You can't necessarily prepare for what your anxiety is going to feel like in a pandemic. Whereas there's a lot of people who've experienced this for the very first time. So I was hoping we could kind of talk through what this might look like for people who are maybe tuning in to find out about mental health in the pandemic and are sort of thinking, oh, maybe I'm falling into these categories and don't realise it. So Jo, do you want to sort of explore that a little bit?
Yes, I mean, I suppose one thing to emphasise is that in all the different boats that we're in, that, people are facing an awful lot of stress, and in an unusual situation, it's quite normal to be feeling anxious, to be feeling a bit low in mood, or to feel like your kind of moods are up and down. And that's all really normal. And I suppose what we need to distinguish is between normal distress in a sort of abnormal situation and what actually goes on to become a mental health problem. Mm-hmm. So I think it's important that people don't panic and think that just because they're feeling, they're struggling. It's human to struggle when we go through something like this. But perhaps if people notice that they're feeling more anxious than usual, or more low in mood than usual, and that's sustained over a period of days and weeks, then that's perhaps a cause for concern. And particularly for people who've had traumatic experiences. Like I said, it's quite normal for those to play on our minds, or even, pop back in our worries or our dreams or our thoughts. But if that's still going on some weeks, 3 or 4 weeks after the event, again, that's a bit more of a cause for concern. And that's when it's probably helpful to speak to your GP or speak to your local psychology services and just see if there's really good help out there for people, and maybe try and access it.
Can I just add on what Jo is saying? Maybe you will agree with me that people who've never experienced mental health issues, now being in a lockdown, many processes are going to start. So regardless of your, for example, age range, if you're, say, single and 35, you might start thinking, for example, about having a relationship or something that you didn't think of before. And many processes when they're started in these, as Jo said, very inadequate conditions, can really make us think about topics that we never, in regular terms, we wouldn't touch or even think about them. And that is then what's going to basically have an impact on people, and we will have more people suffering mental health issues, because when you start the process, then it's very difficult. So, you know, it's being really, in a lockdown, I'm primarily family psychotherapist, and families, you know, if again family dynamics changes within the household, so we are talking some people live as single people, some people are in the families. So when we talk about children in general, we should state that it's their parents as well. They might be more anxious, more stressed, more depressed, and therefore that will have an impact on their children as well. So we don't look this as an you know, isolated case or just an individual case. It's case of entire family. And I very much fear that, you know, we will see rise in mental health issues in days and weeks to come.
And what do you think, Victoria?
I think, as kind of everyone said, I think Tanya's point really about that some people will have to start facing things that are new to them, because I think for some people they've kept very busy as a way of maybe not thinking about some things, and especially if they've had any difficult experiences in the past, that can happen, you know, kind of keeping busy as a way of coping with stuff, and suddenly you kind of can't keep busy, and they've had this very prolonged time of thinking about things. And that can kind of kickstart a process. I mean, it can be ultimately a very therapeutic process, but the initial stages can be really tough. So that could, you know, they could need help with that initially, because it might be quite new to them, really.
Because this has been quite one of the big debates about lockdown, is you have sort of team, let's be super productive, you know, do 1,000,001 things, and the other side of things who are going, okay, it's a pandemic, not a bank holiday, let's, you know, we're allowed to not want to feel motivated, and we're allowed to feel these things. So if you could weigh in a little bit on that for me, Victoria. So why do we want to, you know, be so...
I don't want to do stuff. Well, I think it depends kind of on what you value, doesn't it, in life. And I think for some people it is really hard to just be with themselves. I think it just is really difficult for lots of different reasons, and they've built up lots of ways of not being with themselves. I think learning to be with yourself is a little bit of a skill. I think some people have it naturally, and for some people it's just something they've never really done. I think it really depends on how you were brought up and how much time you maybe had to be with yourself. So I think some of the people maybe who are on the side of, let's, you know, be super productive and do stuff, I imagine the idea of just having lots of time where you're with yourself and with your thoughts could be actually quite scary. And for some people it's just like, you know, they're quite internally motivated and they really like to, you know, get stuff done. You know, I'm an introvert and I've always done lots of stuff on my own, with or without pandemic, and that's just my natural kind of status quo, really. So I think it probably depends on your personality as well. Whereas for other people, if they are actually people who like to have lots of space, but they've been busy with external things because that's how life runs, then it's like, oh, fantastic, it's a great opportunity for me to actually return to a more peaceful kind of state that I used to be in, that perhaps got slightly overrun with external stimulus that are coming in. So it's a bit of a rebalancing, really.
Mm-hmm. It is quite interesting because it's I mean personally for myself, I mean, I totally feel the pressure of, oh my god, I'm not doing enough in lockdown. So what would you say, Jo, to people who maybe are feeling a bit like myself at the moment, who might not be making the most, as it were, out of lockdown? What's the sort of mental health take on that?
Well, I mean, it really varies person to person, but there's been some really good research that's come out recently that's shown that some things are quite protective. So, for example, having a sort of sense of purpose or something that gives you meaning can actually be quite protective, and that tends to be more convincing if it's something that comes from within you as opposed to being imposed from someone else. If your boss is kind of imposing work deadlines on you that you just can't achieve because you're at home trying to homeschool your family of primary school age children or something, you know, that's not going to be achievable. But if people can find their own sources of motivation and meaning, that can be quite protective for people's mental health. The research has also shown that with things like quarantine that can be quite distressing, if people have a sense of understanding why it's happening and actually sign up to that and believe in that, that the psychological impacts of quarantine are much less than for people who feel that it's something that's been imposed upon them and something over which they have no control. And that's experienced by them as a restriction of their liberty, and that creates much more distress for people.
Mm-hmm. And Tanja, what do you think?
Well, basically, I'm referring back to Victoria has said, yes, processes are lovely, and for some people, Corona times might be even beneficial. Why? Because all the things that were under the carpet are finally going to surface out. So that's the positive thing. However, for families, again, many families now, especially if they do have, say, teenagers normally don't tend to sit at home much, and they're not very bonded with the other younger siblings or parents. And my experience shows working with families that many families are now in a better place because obviously teenagers or older, younger adults can't go out as much. So there are totally new family dynamics in place. And many people find it, many clients say that they're really actually having better time at home, and that they really have started valuing things like love and respect and many other things that they did take for granted before. They're now referring to those. So, you know, I work with individual clients, with couples, with families, but so far, as I say, my NHS workers are more on the downside, whereas families are, at least ones I work with, are having better time than ever. So, you know, when you're at home, especially, I always refer to teenagers. I have teenager myself. They're more responsible. They look after some things more, and there will be some positive things as well. So, you know, it's always twofold effect. So as Jo has stated, we will see after scientific research has been done, after Corona is finished, but it will be you know, things on both ends of the spectrum, definitely.
That's quite interesting, because so what does that mean what does that mean when children go back to school? If this is becoming like a really secure, good time, like, I mean, it's obviously not going to feel like an extended school. But I'm sure there's parents out there who are very excited about the concept of schools going back. But going back to that idea of children, I mean, there's a big debate at the moment about whether schools should be reopened on mental health grounds for children. So it'd be interesting to hear your opinions on that.
Oh, if you don't mind, if I just say a few sentences. I worked as a primary school teacher for 11 years. And what we do know is that younger children, whenever we have summer break and we have these 6 weeks off, children just forget to read or write, or they just lose their regular routines. What I'm noticing with my children as well, yes, they do have some homework that they do, but however, it's going to be very difficult for children to readjust to studying conditions again, because many of them see this as a prolonged holiday, and basically education wise it's going to be very, very difficult to achieve targets now, because obviously, yes, teachers did do handouts, and yes, children were supposed to study, but my opinion is that they really were taking lazy time out, and that side, I think it's going to be for teachers and people working in education very difficult, because it's been it's 8 weeks now, and it will take them at least 4 weeks to get back to normal, to resettle the routines they used to have. So that's my experience as teacher, because it's going to be difficult, really.
In terms of mental health, Victoria, how's that going to, do you think schools should be reopened on the grounds of mental health for children?
Yeah, I mean, I think it's actually a really fantastic question, because I think what's upsetting me about the debate of schools opening is that everyone's thinking about the risks of coronavirus and people getting coronavirus or not. But I feel like no one's really weighed up the mental health risk. And I can understand people talk about vulnerable families, and of course for children in vulnerable families, if they are experiencing abuse or witnessing it or anything, or having parents with mental health difficulties, I'm sure that getting back to school and being with some adults who are perhaps a little bit more able to kind of meet their needs will be very helpful. But I think what's going to be really different, though, is they're returning to an environment that is really different. there'll be constant reminders of the risks of coronavirus, because, you know, everything will be changed. They'll have to distance, they'll have to wash their hands all the time. And what we know about kids, you know, who have to go through very difficult experiences of sort of unprecedented kind of trauma, is that the more exposure they have, you know, being reminded about the thing that's happening around them actually can have quite negative consequences for them. And also, if they are with adults who are stressed, that is also a very big thing. So for a lot of children who are actually at home, and maybe, you know, maybe they are thinking it's a bit of a holiday, but they're actually feeling safe. Maybe they're not having to think about coronavirus a lot because they're not going out a lot, you know, they're just in the house, they're not really being reminded about it. They're probably kind of in quite a good place for their mental health to be good. And then they'll suddenly return to school, they'll suddenly be faced with all the kind of restrictions. And I think especially for younger kids, constantly inhibiting the normal social responses, I just kind of wonder what the consequence of that will be. There isn't really research into this because this is, you know, a bit unprecedented. There's no, you can't go and check, you know, what the latest is on making 5-year-olds social distance at 2 meters, you know, for a lengthy period of time. My gut instinct from working with children who've had to inhibit other kind of normal responses is that it often creates mental health difficulties later. So I actually think you have to weigh up the two things. So yes, for the vulnerable kids, it probably will be positive, but for the kids who are at home feeling safe, it might actually have a negative consequence.
Yeah, completely.
Just to add on Victoria's thought, this year our A-level students and GCS students have really been hit badly, especially people who were about to start their universities. They're still in suspense, waiting whether they're going to have an entrance exam or not. So these two categories, GCSEs and A-level students, are really going to be hit a lot.
Completely. Well, if you're, you know, especially, you know, the rite of passage of going to university or graduating high school or moving up from primary school to secondary is obviously being completely eradicated in these times. What do you think, Jo?
Yeah, I mean, I don't work with children, so I will defer to my colleagues, but I do work with university students, and their studies have been really disrupted, actually. I mean, myself and my colleagues at university have been really struck by the resilience amongst our students, and they've adapted brilliantly well to working remotely, and not just the technology, they've been way ahead of the academics, but they've actually really kind of found ways to get their needs met by connecting with each other. So there's been a lot of creative ways of working that's actually been really, really, really positive. I suppose, I mean, this isn't my professional opinion, but I've been quite struck by images that I've seen about the setup for getting children back to school. And I've been very struck by these images of sort of hazard cordoned off small 2-meter areas that each individual child is allowed to sit in. And I saw some footage from children in France, with just individual children just sitting in these squares, and that's so alien to children who are by default at that age kind of wanting to connect with a social group and feel part of a pack. So yeah, would really reiterate Victoria's point that children are resilient and they're very adaptable, but there are mental health consequences of going back to school as well as not going back to school, and that really warrants a bit of thought.
And referring to your experience with obviously PTSD, Jo, like, is this something like that would categorise as the sort of trauma that would bring this on if you were going back to school in these sort of restricted measure ways?
I mean, trauma is an interesting definition, because to be given a diagnosis of PTSD, the kind of definition of what a trauma is very specific. It has to be an event that threatens your life or your emotional, sexual identity and integrity. So I don't think we could say that this is traumatic in the way that we would diagnose PTSD to, but nevertheless, it's really disruptive and it's incredibly distressing to children, and we keep talking about this event being unprecedented, but actually there's quite a lot we can learn from other pandemics that have happened. And we saw after illnesses like SARS or MERS, we actually saw we have seen these increases in psychiatric presentations afterwards, in children and in adults. So it's not our normal, but there is research, there are studies out there that show that children are affected by both the illness but also the social restrictions placed upon them.
Well, sort of going on from that more into sort of post-pandemic, so again, one of the big debates that have been on COVID Action Network this week are the debatable silver linings of this all when it comes to mental health. And we've had people discuss that this will, cause people to be more resilient, and the pandemic might help mental health become less taboo, because obviously it's something that people are being far more aware of. We've got this surge in potential first-time patients. What's your take on that in terms of resilience, Jo?
I mean, it's going to be mixed, and it's going to be really interesting to see how this pans out, because this pandemic has created opportunities that my colleagues have spoken about for families to connect or reconnect in ways that are quite helpful. It's created opportunities for people to live a bit more mindfully without the same pressures of work and commuting and social obligations. So that there have been some opportunities in here. People are talking about mental health. That's a really positive thing, actually. It's something that's been talked about much more in the last decade or so, and something that wasn't talked about with SARS and MERS and some of those previous pandemics. So those things are really positive. People want to help. We've got people out every Thursday night at 8 o'clock clapping for carers and recognising that. I think what's going to be really important is that these things are sustained. I think, taking the example of health and social care workers, it's been of huge value to them that their input has been recognised, but the risk we run is if we then forget about that and they go back to the same kind of pay conditions, scenarios that they've been in, given all the sacrifices they've made, that can then lead to a sense of betrayal from the wider world, and also from employers and governments and organisations. So we've got opportunities here, but we've also got the opportunity to really mess it up and not make the most of those opportunities. So interesting to see what happens.
Completely. And Victoria, what do you think? Is there necessarily a positive for mental health in all of this?
I think that definitely for families, I think the presence of parents for some children will be really, really important. I mean, I've certainly spoken to some parents, especially of teens, perhaps teens who are going out a lot, maybe experimenting with things like drugs and getting into specific sort of difficult social situations. Actually having the restrictions around that and having their parents much more present has actually stripped that right back. So I think for some teens for whom parental presence was kind of needed, or just children in general for whom parental presence was actually something that was really needed, it might be a really positive thing, allowing them to kind of essentially change their trajectory as to where they're going. And so I definitely think that. And I think certainly for adults who are quite adaptable and maybe haven't been in this kind of situation before, but are able to adapt to it and are able to learn ways of being with themselves and are able to teach their kids ways of being with themselves, then yeah, they will have skills for life for later, and that means whenever they are hit with a very unusual situation where they have to deal with difficult things, they will have some skills that they have already learned. So I think for some individuals, I'm hoping there will be a fair amount of them that will be a really positive thing. At the moment, I think it's really hard to know what there'll be more of, the people gaining kind of those resilience skills, or whether it will be, unfortunately, the people who are having mental health difficulties.
And what do you think, Tanja?
Exactly the same as Victoria and Jo, so I really don't have anything much more to add. We will just see after Corona is finished, and we will definitely have studies to address different things. But just referring back to Jo, I've seen those pictures as well, children being at school and being at 2 meters distance. And when I really looked at those photographs, I felt sad, because it's really our time when we were going to school or going to university, it was all about social interaction. So my worry is, even when all of this is finished, not only children but younger adults, relationships, who would want to engage in a relationship, and who would want to be with someone at a very short distance. So we are yet to see. I'm always positive, and I want to see this positive end of the spectrum where families are gonna really find their resilience and learn new skills. But as I say, on the other hand, it's going to be definitely difficult. It's going to be different, and when something is different, we need to be fast in implementing appropriate measures to tackle the issue. So we can now stipulate and give our opinions, but really it's people who implement all of these measures. It's up to them really to make the best decision for all of us.
And Jo, what's your take on resilience? I mean, for people who are listening, what sort of, when we say resilience, what can we kind of expect from the pandemic in terms of mental health?
I mean, I think one of the most important things to emphasize with what we mean about resilience is not the absence of distress. It's not the absence of struggling. It is technically the definition of being able to bounce back. So to experience distress, experience things that are difficult, but to accommodate them and assimilate them in our sense of ourselves and our families and our life. So it's not just sort of bouncing back to where we were before necessarily, but arriving somewhere where we feel okay in ourselves and with our families and our situation. So that's really what it means to be resilient. It's not about returning to where we left off. It's about experiencing the difficulties that we're going through and the distress that might come with that, but finding a way to live with that and kind of move on with our lives in the direction that we want to.
And I suppose finally, to sort of round things off, I'm just aware of the time at the moment, what advice would you give to the people who are watching just now or will be listening onto this on a podcast element? What advice would you give to them in these sort of extraordinary times on how to cope with, maybe if they're feeling sort of negative mental health? Victoria, if you'd like to start.
I think for me, a bit as Jo said, maybe not jumping the gun straight away, because I think we all have periods of time when there is a bit of a gear shift. So as things change in what is expected of us, I think those shifts can be quite difficult, and not necessarily assuming that means that you have mental health difficulty. But if it has been going on for some time and you really, that the bounce back kind of isn't there, really making sure that you do bother your GP with it, and that you do get your support, because actually certainly in terms of kids, you looking after yourself is really going to affect them as well. So kind of looking after yourself first, and similarly if you're noticing something in your child, obviously they will have again gear changes and shifts, and they might last a week or so, and then that's quite natural. But if it's really kind of going on, just to make sure you do get some advice about it.
And what about you, Tanja?
Well, psychotherapists normally suggest CBT, which is cognitive behavioral therapy, which is here and now. We should really look after ourselves in regards to eating healthily, sleeping on time, trying to do, daily duties as quotation mark uninterruptedly. So here and now, because we don't know what's going to happen within the next few days or weeks, just follow simple CBT rules, and as Victoria said, monitor on behaviors that are not appropriate or that are changing, and just keep track of it, so that obviously when you approach professional, you can give them, the report of how you felt, how do you feel. But we definitely always suggest CBT, so these measures definitely.
And Jo, finally from you, what sort of advice would you give to people who might be struggling at the moment?
Just like Victoria and Tanja have said, really, to just look after yourselves, be compassionate to yourselves and your family members and other people, and acknowledge that this is a really difficult time for people. It is really challenging. But if you find yourself struggling more than usual, or that's going on for much longer than usual, whether that's yourself or a family member, seek help. Even if your GP says, what, I think this is just, it isn't a mental health condition, it's just, a difficult time, that's fine. But they might say, actually, what, there's something out there that could really help you, and they'll link you in with that help.
Amazing, thank you so much. So a massive thank you to all three of you for providing such amazing insight on this massive topic. Obviously it's Mental Health Awareness Week 2020, so thank you so much for taking the time to take part of this. And for anyone that's tuning in, this talk will be available on YouTube and as a podcast via the COVID Action Network site from next week, if anyone's missed it. And COVID Action Network Talks will be back next week on the topic of tech and trust during the pandemic. So thank you so much, everyone.
Thank you.
Thank you. It's been a pleasure.
Thank you so much.
Thank you.